I'm Maddy Liebing. I'm the clinical director here at both Legacy Outdoor Adventures and Juniper Canyon. I'm a psychologist and a marriage and family therapist. And I also do horses. So I like to hang out with these guys. And the women and the men that come down and spend time with them, it's pretty powerful for them. We get to have some pretty amazing experiences for them. This one's falling asleep right now. Her name's Firefly. It's an amazing thing with these guys because their heart is so strong, and just being around them helps our hearts to slow down and calm down. And I can have clients come down here, men or women, and they'll come in kind of angry or frustrated or down or whatever. And almost universally, by the time they've spent even an hour and a half just hanging with the horses and doing things, being around them, they start lightening up and they leave smiling. And it's just a very amazing intervention. And it takes quite a bit to be able to maintain it. You have to have a field, you have to have hay, you have to have equipment, you have to have veterinary work, all these different things to maintain these guys. But the result is really, really helpful. And one of the reasons I like the program is because we've got a combination of being here on base so that we can be around the horses and do trail rides and stuff around here. And we also have the wilderness part. I do a lot of trauma work, and what we found is that there's a very high prevalence of trauma behind substance abuse and other mental health issues, anxiety, depression, other kinds of things. And so I like to be able to help people be able to heal from trauma. But here's one of the things about trauma and about even just normal development is that we end up a lot of times with what's described as a chattering monkey in our brain, things going around and around and around and around. And I remember specifically a workbook on PTSD, and what it was talking about was being able to stop the chattering monkey, because we have the capacity to heal. Neuroplasticity of the brain is amazing. And if we can slow things down and be grounded and be centered and be present and not be worrying about the future or the past and just kind of let them go and slow down that chattering monkey, the healing naturally happens. And what's interesting about that is, as a therapist in my office, I try to create an environment where people can be grounded, can feel safe, and can really just be present. If you go outside and you just go out here for a walk, or just sit out here in the rabbit brush or next to the stream and just watch the stream go by, or sit by a fire, you are getting that environment in 360 degrees, 24 hours a day, place of healing. It slows people down, it helps them be present, it helps them to be able to stop the chattering monkey and to be able to just be, mindful. And be able to be safe. And then when they can do that, the brain is naturally going to heal through the neuroplasticity of the brain and helping with the trauma and all the emotions that they're experiencing. So it is magical. I've been taking kids out since 1978. We started out just doing 6-day treks. That as a high school counselor, we just take kids out 6-day treks. And I had people come back to me years later. I would see them in the grocery store, and they'd have 3 kids with them. And they'd say, "Oh, do you remember me? I remember, remember when we went out on," we called it survival. That's what we called it. It wasn't, it was just backpacking. And they said, "That changed my life." And that was a 6-day intervention. In fact, I did my dissertation on that specifically, on what changes occurred for people just in a 6-day intervention. We included a solo where they could spend some time by themselves, and then the rest of it was basically backpacking and adventuring, sometimes rappelling, that kind of stuff. And it had a huge impact. And even with just a 6-day intervention on my dissertation, this is in 1985, there was, measurable results in 2 major areas. The first one was just self-concept. Just feeling better about yourself, like I can do hard things and I can do this. I mean, putting everything that you need on your back and heading off into the wilderness and being comfortable with that is just amazing. And that increased their feelings of self-efficacy and ability to be able to do hard things. And the second one was kind of self-concept regarding your family. They came away a week later, just a week, feeling more appreciation for their family and more resolve to be able to be a better family member. And that's only a 6-day intervention. And that was way back when. The more we've done it, the more we've been able to see the actual changes that take place. And I think it's all of those pieces is being able to be self-sufficient and at the same time a part of a community, and being able to overcome really difficult things, which could be just hard hiking or could be rappelling or something that's really scary but safe. And so it's like we just expand ourselves in that environment. And then I have one other theory about it, is I think we really are nature people. The earth is a part of us. We're part of the earth. And what we've been doing is cementing ourselves away from it with roads and cement and skyscrapers, and eventually you don't even see green. I think we need this outdoors. We need the sky and the stars and the water and doing cold plunges. We just need to be outdoors and be a part of the earth because we are a part of the earth. And I think what it does is it helps us in healing to go back to what we really are, a connection with the earth. When Gil and the guys here put together this hybrid program from a therapeutic standpoint, from a clinical standpoint, I think we can get more work done for trauma. I do EMDR and ART. We're a couple of trauma things. And the other thing that we can do because we're here that I think is extremely important is that we have capability of doing Zoom calls with parents. And so we can actually do family therapy. What we're doing here is we start doing family therapy at about week 3 and do it every week for an hour or an hour and a half, and then have families come out for 2 days and then keep doing the family therapy. So I've done as many as 9 or 10 family therapy sessions and the family workshop. And I think that has a big impact as well. We have a licensed dietitian. She does nutritional assessments for us for eating disorders. And then they can meet with her like a half an hour every week if we need to. And then she can work with our logistic people to make sure they have the right food and stuff. So it just gives you a lot more resources to help with the specific needs that a client has. And then the combination of actually the transition in and out is really good because young adults are in a life transition area where they're going to school, coming home, going to work, taking another job, and going to do summer work, whatever, all different things. And so helping them learn how to do transition is really, really helpful. And then it also helps us teach them how to live like in a dorm, how to cook, how to do menus, how to do their laundry and clean things up and keep things nice, and helps them to be able to be good citizens when they go to college, if that's where they end up going. You can get much more enduring change with this combination. It's just a powerful intervention. And like I said, I've been doing it since 1978. It's